Good morning, class. Today, we will be diving into the fascinating world of medical nanotechnology and exploring its applications in the field of cardiovascular drug delivery. Nanotechnology is a rapidly evolving field that focuses on manipulating materials at the nanoscale level, typically 1 to 100 nanometers, to create novel and efficient drug delivery systems. In recent years, there has been a significant interest in utilizing nanotechnology to address the challenges associated with delivering drugs to the cardiovascular system, which is known for its complex anatomy and physiological barriers. Now, let's begin our exploration with the first topic. The cardiovascular system plays a crucial role in the overall functioning of our body. However, delivering therapeutic agents to specific sites within this complex system can be extremely challenging. Nanoparticles offer a promising solution to overcome these challenges. By engineering nanoparticles with specific properties such as size, shape, and surface characteristics, we can enhance their circulation time in the blood, improve drug stability, and target specific cells or tissues. This enables efficient and controlled drug delivery to the cardiovascular system. The design of nanoparticles plays a vital role in their effectiveness as drug delivery carriers. Factors such as nanoparticle size, surface charge, and surface modifications greatly influence their interaction with biological barriers, such as the endothelium and cellular membranes. Additionally, the choice of materials used to fabricate nanoparticles can affect their stability, biocompatibility, and drug loading capacity. Therefore, meticulous design considerations are essential to optimize the therapeutic efficacy of nanoparticle-based drug delivery systems in cardiovascular medicine. Targeted drug delivery is a crucial aspect of cardiovascular medicine, as it allows for precise and localized treatment of diseased tissues while minimizing off-target effects. By functionalizing nanoparticles with ligands that selectively bind to receptors overexpressed on diseased cells, for example, tumor cells or activated endothelial cells, we can deliver drugs specifically to the desired sites. Furthermore, active targeting strategies can enhance nanoparticle uptake by endocytosis, increasing the therapeutic payload delivered to diseased tissues. Nanoencapsulation refers to the process of encapsulating drugs within nanoscale carriers, providing protection from degradation and facilitating controlled release. A variety of techniques, such as polymer-based nanoparticles, liposomes, and solid lipid nanoparticles, have been employed for cardiovascular drug delivery. These encapsulation systems can protect the drugs from enzymatic degradation, enhance their solubility, and prolong their circulation time in the bloodstream. Additionally, the release kinetics can be tailored to achieve sustained or triggered drug release profiles. In addition to drug delivery, nanotechnology offers exciting opportunities for real-time monitoring and diagnosis of cardiovascular diseases. Nanosensors can be engineered to detect specific biomarkers in the blood or tissue, providing valuable information about disease progression or treatment response. These nanosensors can be designed to be minimally invasive, allowing for continuous monitoring, and can even be integrated with wireless communication systems for real-time data analysis. Such advancements in nanosensors have the potential to revolutionize the diagnosis and management of cardiovascular diseases. Theranostics combines therapeutic and diagnostic capabilities into a single nanoscale system. Theranostic nanoparticles hold immense promise in cardiovascular medicine as they allow for simultaneous imaging and targeted drug delivery. By incorporating imaging agents within the nanoparticle structure, we can visualize the delivery, distribution, and accumulation of nanoparticles in real time. This real-time imaging provides valuable insights into the efficacy of treatment and allows for timely adjustments if necessary. Stimulus-responsive nanocarriers are smart drug delivery systems that can respond to external stimuli, such as temperature, pH, light, or magnetic fields, to trigger drug release. This capability is particularly advantageous in cardiovascular medicine, where the microenvironment of diseased tissues can differ from healthy tissues. Stimulus-responsive nanocarriers can be engineered to release drugs in response to disease-specific cues, enhancing treatment efficacy and minimizing off-target effects. Biomaterials play a critical role in tissue engineering, which aims to regenerate damaged or diseased tissues. Nanotechnology has revolutionized the field of cardiovascular tissue engineering by providing innovative materials with enhanced properties, such as improved biocompatibility, controlled degradation, and mechanical strength. These nanotechnology-based biomaterials can be used as scaffolds for tissue regeneration, providing structural support and promoting the growth of new functional tissues. Magnetic nanoparticles have garnered significant attention in recent years due to their potential in targeted cardiovascular therapy. By functionalizing nanoparticles with magnetic materials and applying an external magnetic field, we can guide nanoparticles to specific sites within the cardiovascular system. This magnetic targeting approach allows for enhanced drug accumulation in diseased tissues, leading to improved therapeutic outcomes and reduced systemic toxicities. Nature has provided us with numerous inspiration for designing advanced drug delivery systems. Bio-inspired nanodevices mimic the natural structures and processes found within the body to enable efficient drug delivery to the cardiovascular system. Examples include biomimetic nanoparticles that replicate the structure of red blood cells to evade immune clearance and nanostructures inspired by viruses to enhance cell-specific targeting. Such bio-inspired nanodevices hold great potential in overcoming the biological barriers encountered during drug delivery. As with any emerging technology, the potential toxic effects of nanoparticles must be carefully evaluated. Nanoparticles can interact with various biological components and may induce cellular toxicity or immune responses. Therefore, comprehensive studies on the safety and biocompatibility of nanoparticles are essential before their translation into clinical applications. Understanding the nanotoxicity considerations allows us to design nanoparticles that are both safe and effective for cardiovascular drug delivery. The successful translation of nanomedicine from the laboratory to clinical applications is a challenging task. Regulatory approval, scalability, manufacturing, and cost-effectiveness are some of the critical considerations that need to be addressed. However, several nanomedicine-based therapies, such as nanoparticle-based drug-eluting stents, are already in the clinical stage, paving the way for the broader integration of nanotechnology within cardiovascular therapeutics. In conclusion, medical nanotechnology offers immense potential for revolutionizing cardiovascular drug delivery. The precise design of nanoparticles, coupled with their targeted delivery and real-time monitoring capabilities, allows for efficient treatment strategies with reduced side effects. However, thorough understanding of nanotoxicity, rigorous testing, and successful clinical translation are crucial steps in realizing the full potential of nanomedicine in cardiovascular therapeutics. Thank you for your attention, and I look forward to discussing this exciting field further in our next class.